For recovery following deep excision surgery. I'm going to talk about what I did, just a disclaimer that you'll want to talk to your doctor about what's right for you with anything that I mention here. So the first thing is, following surgery, you will want to avoid in the first couple of days talking. The reason is because you're going to have gas that's pumped into your stomach, and through talking you can bring that gas up into your shoulders. It can be very painful, so just know that. Another thing is that you don't expect any huge wounds. If you're having deep excision surgery, it's going to be done laparoscopically, minimally invasive. You'll have very just small wounds. There might be a couple of them, however, on your abdomen. You will be bloated. You will want some sort of gas relief and some sort of constipation relief. As far as pain medication goes, you realistically should be able to get off of that within a few days. And honestly, you do want to do that because it will hinder your healing experience. You should be able to transition to more of like an on and off of like Advil and Tylenol. And that is not meant to be used long term. Talk to your doctor about all of that, of course. Now, heat and ice, you're going to want to use both. Keep in mind, though, that heat can actually cause issues with the healing process, so please don't put heat directly on your abdomen. I would recommend just putting it on your back or laying on top of heat if you need some sort of heat relief. And then ice would be great for your tummy to help with the bloating and the inflammation and all of that. Now, your doctor is going to tell you that you are going to be able to go back to work within just a couple of weeks and be back to more normal and tip-top shape. I am a certified integrative women's health coach with a specialty in endometriosis. From the integrative perspective, we say that it can actually take your body more like 6 months up to 2 years to fully heal from a surgery like this. Okay, keep in mind that sometimes people actually have to have organs removed and a lot of work can be done. And so that internal healing can take a lot of time. I can tell you from my own experience, it took me an entire year, and I did have some difficulties and complications and further like things that I had to investigate following surgery. And so yeah, the road wasn't like, I wasn't just like back to normal after 2 weeks. So don't expect that. Make some sort of arrangements with work. Like I honestly, depending on like how physically demanding your job is, you will probably want some sort of doctor's note to at least like make some sort of accommodations, once you do go back to work. But realistically, you should be able to go back to work within a couple of weeks though. You'll just want to take it easy.